Ms. Nadia Samdin.
Mr. Speaker, sir, may I address PQs for oral answer 9 to 13 in the order paper, and also the oral PQ filed by Mr. Louis Chua for the sitting on or after 10th May, please.
Please do.
With the pandemic situation stabilized, the Multi-Ministry Task Force, or MTF, took decisive steps to open up social and economic activities to almost pre-COVID norms. So to Ms. Sylvia Lim's question, temples can start to organize dinners, barring any changes in rules later. Mr. Lim Biao Chuan asked if individuals who are not fully vaccinated can be allowed to enter malls and dine in F&B outlets. I would like to clarify that they can enter malls, as we have significantly removed vaccinated differentiated safe management measures, or VDS, for non-fully vaccinated persons. However, we still need to remain cautious because the next infection wave is highly possible. We also need to watch out for new variants that may threaten us again. Hence, the MTF decided to maintain VDS for the three most risky settings: nightlife outlets with dancing, events with more than 500 participants at any point in time, and then F&B outlets, where there is a constant flow of diners who are masked off and interacting. But for F&B outlets, we will, however, not deploy trace together and safe entry, and instead put the onus on customers to ensure that they are fully vaccinated before visiting an F&B outlet. And we will continue to review our VDS measures as the pandemic situation evolves. Hence, we are taking a cautious step down but not dismantle posture for our public health measures. If the situation requires, we will have to step up VDS and reactivate TT and SE. Ms. Nadia Samdin asked what the criteria are to reactivate these measures. It is a matter of judgment, depending on the severity of the situation. And we will have to take into account if there is a new variant of concern, whether it is more severe or more infectious than Omicron variant, whether past infections and current vaccines continue to confer strong protection against the new variant, and how all these affect our hospital capacity. I can understand some members of the public and members of the House want a system with transparent and clear triggering points, but I'm afraid this is not possible when we are in a pandemic crisis with fog of war. But through the MTF's actions over the years, I hope the public would also appreciate where we are coming from. We do what is necessary to protect lives when danger is upon us, and we will step down measures when they are no longer needed, no longer necessary, so that people can resume their normal lives. So the best step for the public to take is not to delete your TT app and not to throw away your TT tokens. Please keep them. Members asked about the DOSCOM framework, the Disease Outbreak Response System Condition Framework. DOSCON was established after SARS in 2003, then reviewed and progressively improved from the experiences drawn from managing the H1N1 pandemic in 2009 and the coordination for Middle Eastern Respiratory Syndrome coronavirus and the Ebola virus disease. Post-COVID-19, we will certainly review it further, along with our response measures, given all that we have learned during this pandemic crisis. The DOSCON framework was developed as a tool for ministries and agencies to coordinate and execute the government's response to the outbreaks of infectious disease. By and large, it has served this purpose well in this pandemic. In the initial phase of the pandemic, the MTF decided that for transparency, we would announce the DOSCON level and color code publicly too. This would help alert the public of the need for personal vigilance and social responsibility. However, it had also led to certain public reactions, such as a rush to the supermarkets. And this is one key issue for review as DORSCON is meant to bolster preparedness, not to induce public anxiety. So a key factor to consider in our review of the DORSCON framework is that after more than 2 years of pandemic, the government and our society have learned a lot about pandemic response. We have developed a comprehensive response system covering health protocols, border controls, and safe management of social and economic activities. It is also tiered and differentiated, catering to different activities and settings, such as schools, offices, public spaces, eating places, nightlife, events, etc., with various severity conditions. Therefore, from a public communications point of view, we believe that the public now pay much less attention to the DORSCON color code and take care to understand the various public health measures in detail and then respond and do their part accordingly, be it taking vaccination, wearing masks, or abide by safe management measures. So I'm confident that today we have a much more sophisticated public that understand what they need to do when the pandemic turns for the worse. The response of the public and the contribution of everyone in our society is ultimately what gives us resilience during a pandemic outbreak. So the DORSCON framework is most likely still relevant, but it needs to be part of a larger emergency preparation and public communications framework that we have already developed and now people understand. Members also ask about excess deaths. Let me first explain what it is. It means comparing death rates across the years, taking into account the changing age profile of the population. If the death rate goes up in a pandemic above that expected in the absence of a pandemic and over what is expected from population aging, it means there are excess deaths. For Singapore, our age standardized death rate has decreased from 2017 to 2020, from 563 per 100,000 residents to 519 per 100,000 residents. Then in 2021, the rate increased to 557 per 100,000 residents, almost back to 2017 levels. So 2021 level is about the same as 2017, just a notch lower. So there are excess deaths in 2021 compared to 2020. Mr. Leon Pereira asked why is that so and how we calculate excess deaths. We use well-established, internationally practiced methods, including age adjustments. And there are excess deaths in 2021 because there has been a global pandemic causing billions of deaths around the world, and Singapore is not exempted. During a pandemic, excess deaths will be higher than the officially reported deaths directly caused by the disease. Yeah. To illustrate, a recent WHO analysis of excess deaths found that while the officially reported number of COVID-19 related deaths around the world is slightly over 6 million, but excess deaths during this pandemic is 15 million, so 2.5 times more. There are a few reasons explaining the difference in these two numbers. One, in some parts of the world, there can be underreporting in regions where testing is insufficient or where data is difficult to collate. But in Singapore, this is not an issue. Two, there are infected persons who died of other illnesses, but COVID-19 infection might have been a contributory factor, but not the main cause. Three, care-seeking behaviors changed. For example, individuals with chronic conditions may put off their checkups and treatments and medication during the pandemic to their own detriment. Four, there are many regions where the healthcare systems were overwhelmed. When that happens, proper care is denied. And the people who suffer are not just the COVID-19 infected patients, but everyone that needs hospital care. Our excess death in 2021 among Singapore residents is about 1,535. That's for 2021, when we had a Delta wave, after accounting for aging. COVID deaths as at end 2021 among residents is 804, or about 52% of excess deaths. The remainder excess deaths could be due to some of the factors I explained earlier, except underreporting is not the issue in an urban environment like Singapore, and also the last reason I mentioned, hospitals being overwhelmed. That's not a big factor here because we prioritize the protection of our healthcare system, going into a circuit breaker when necessary. So although our hospitals came under significant pressure at the height of the infection waves, they were not overwhelmed, and hospitals could continue to give priority to serious and urgent cases. As mentioned in the MOH press release on 24th March 2022, MOH is continuing to collect and analyze the data, particularly the recent Omicron data, to find out more comprehensively the impact of this crisis on Singapore residents, and we will release a special report soon to estimate the excess deaths over the past 2.5 years of the pandemic and the key factors causing the excess deaths. I should emphasize that whether it is official COVID-19 death toll or excess deaths, Singapore will have one of the lowest rates in the world amongst countries that have chosen to live with COVID-19 and resume normal lives. And that is because of the cooperation of everyone in Singapore and the effectiveness of protecting our healthcare system.
Ms. Nadia Samden.
Thank you very much, Speaker, and to the Minister of Health as well for the response, including setting out some of the criteria which will be taken into consideration for the reactivation of the Trace Together program. I have a follow-up SQ, and it really was an article in the Straits Times yesterday, which said, and I quote, that Trace Together tokens and even safe entry gateway boxes are government properties, and throwing them away could be considered an offence. And it then goes on to list certain offences under the Penal Code, Vandalism Act, and Computer Misuse Act. And I think this causes some alarm among people who may have inadvertently disposed of or misplaced their tokens. So it'll be very helpful to have some clarification on what to do with these tokens and what happens if there has been any inadvertent disposal, as well as some assurance in terms of the data that is or isn't collected while the app still remains in the phone. Thank you.
Thank you. I read the article as well, and I thought there might be an SQ on it. I will need to check with GovTech with regard to the status of all the equipment. As for those who have inadvertently disposed of them, do report them. So I'm sure government agencies will be as helpful as they can to try to replace them. I think our key consideration is not so much about protection of the equipment, but to make sure that should we have another variant of concern, businesses, individuals, we are ready to respond. Ms. Nadia Samden also asked, Mr. Speaker, sir, about the data. I mentioned this in an earlier reply, which is that for events, for example, nightlife with dancing, where SE data is still collected, it will be purged very quickly. Yeah.
Mr. Willen.
Thank you, Speaker. I have two supplementary questions for the Minister for Health. Earlier, he mentioned that VDS or vaccine differentiated measures would still be needed for events of more than 500 participants. So can he clarify that this also applies to the community dinners that I asked for, meaning that if the number of participants is expected to be more than 500, then the organisers will have to check that the participants are vaccinated? So that's the first question. And the second question, he mentioned that these dinners can proceed. What about events or activities that are associated with the dinners, like auctions and stage performances like Ge Tai? Are all this also allowed? Thank you.
Answer to both questions is yes. So if the temple has a temple dinner has more than 500 people, they ought to install a SE check-in counter. And auction performance can proceed.
Mr. Lim Beltran.
So I'm trying to see whether the unvaccinated can live their lives normally as with the other Singaporeans. I spoke to some of the unvaccinated people, and they shared that for many of them, they choose not to be vaccinated because they are worried about the severe adverse reaction. Now, Minister, you have said that healthcare system is not overwhelmed. Majority of Singaporeans are vaccinated. So is there any way in which we can really consider removing some of the vaccinated differentiated measures so that those who choose not to be vaccinated for whatever reasons, they can lead their lives as per the rest of Singaporeans? There are only about 3.5% of such people, and really they ought to take responsibility for their own decision not to be vaccinated.
Indeed, we all take responsibility for our own health and make our own decisions regarding our own health status, including vaccination. The issue that we do need to consider here is that in a pandemic crisis, that individual decision also affects society and the healthcare system. The member remembered that 3.5% of our population are not fully vaccinated. They accounted for 20% of ICU cases and deaths, and also add to certain workload to our healthcare system, which in extremis, when the numbers are huge, when we have a big wave, it may mean adding a lot of pressure to our healthcare system. And when that happens, it's not just the unvaccinated that will suffer, not those who are infected that will suffer, but everyone that requires hospital care, acute care, and emergency will suffer. And so it's because of that, that decision not to vaccinate yourself is no longer just it's no longer just about yourself. It's about also a role for us to protect the whole society. Having said that, the last time the member asked me that question, since from then to now, we have relaxed many of the VDS restrictions for this group because given the current situation, we don't think it's needed. But we do worry about the next VOC. It's most likely it will evolve and emerge in the months to come. And so given that posture, I think just maintain these three most risky settings where BDS still applies. And we'll continue to review the situation.
Mr. Leon Pereira.
Thank the Minister for his comprehensive answer. Just procedural clarification. If I heard correctly, the Minister said he would answer all questions until 13. I'm just wondering, has he answered question 13 as well, which is about the impact of restraints placed on non-urgent treatment and testing during COVID, and what backlog there has been for such treatments and testing. What has that impact been?
Thank you. I intend to answer question 13. So whether Ministry will conduct a study on the impact of COVID-19 pandemic on various aspects. As I mentioned, that we have issued a press statement earlier in March. 24th of March. We have issued a press statement that we will collate all the data, we'll do a proper study. It's a special report on the impact of the entire pandemic, and we will answer some of the questions, including the data required.